Okay, welcome everybody. Welcome to Anwan Wellness. I've been doing anti-aging and functional medicine for about 18 years. And my career started in corporate America, where I was able to have the opportunity to work for two Fortune 500 companies, one being Cigna, the other one being Aetna. And what I noticed as a medical director for those groups is that the people who didn't have good lifestyle, they cost more money. They're the ones that ate poorly, did not exercise, smoked, and they're the ones who were stressed out, and they ended up with strokes and heart disease, diabetes, and obesity. So the managed care organizations tried to practice what they called care management or health maintenance. So that preventative aspect of healthcare is what I gravitated to. Then I got involved with the American Academy of Anti-Aging and got into nutrition even more so, exercise, and all the hormone restoration principles that are out there, and we currently do it. Our most recent addition to our practice is stem cells. We will be having a seminar on stem cells on February 21st, so you guys should mark your calendars for that. We're also doing PRPs as well, platelet-rich plasma, for joint injuries, strains, and sprains. Okay? So, but today's talk, I'm going to talk about a topic that's very dear to me, which is hormone restoration. You know, a lot of folks don't understand that as you age, your hormones go down. Growth hormone goes down when you hit 30. At the age of 30, growth hormone goes like this. Growth hormone is very important for your energy level, for your ability to heal, for your recovery when you exercise. That is why younger people heal better, because they have high levels of growth hormone. When a man hits 40, 45, his testosterone plummets. Normally his level would be 800 to 1200 or so. When he hits that age group and he's gotten a little bit more weight on him, his testosterone plunges. What happens? You start getting more belly fat. You don't have as much energy, right? Your libido goes down. A variety of things happen. So that's what we call male menopause or andropause. Now women have always been very loud about menopause, so everyone knows all the symptoms of menopause, right? They'll start losing their hair. They'll have hot flashes. They'll have night sweats. Those are vasomotor symptoms. But then what you don't know are the things that's going on metabolically that's not so evident, like bone loss, like increase in heart disease. When a woman goes through menopause, that's what happens. So I'm going to talk about women first, because women should go first. We firmly believe that the women have their key roles in the family, and they're usually the ones who are dragging the men to the doctors anyway. So what I'm going to talk about, we're going to describe the signs and symptoms that are related to hormone imbalance in women. We're going to talk a little bit about the reproductive cycle, and we're going to explain the symphony of hormones. We have a bunch of hormones in our body. You don't think about it, the hormones are working. The brain, the master regulator, tells the body what to do, from the thyroid to the adrenals to the ovaries to the testicles to the pancreas, whatever. The brain controls it. And the brain has these stimulating hormones that tells these organs when to produce hormones. So you got to understand that. We are being regulated by our brain. We're going to look at some of the hormone replacement strategies if you decide that that's something that is important. My goal is to convince you that replacing your hormones or restoring them to a youthful level is the way that we should all think. It's the best anti-aging strategy, but it's not the only one. So when a woman has hormonal imbalance, these are some of the things that I highlighted a little bit before. Sleep disturbances, night sweats, anxiety, nervousness, irregular menses, mood swings, fatigue. They get wrinkled more so as the estrogen reduces, and then they lose their sex drive or their libido. They can have, if they have high estrogen, they'll have breast tenderness, fibroid growth, start retaining water, and then just getting a bad mood before. This typically happens in younger women before their menstrual cycle. As they get a little older, they get some leakage, incontinence, dryness of the genitalia, and painful intercourse. So the conventional wisdom is that when a gland dries up or ages and gets replaced with fat and scar tissue, you should accept the fact that you're getting old, and you should not do anything about it. They also said, well, you should replace hormones such as insulin, obviously, because if you have diabetes type 1 and you don't have insulin, you're going to want to take insulin so you could regulate your blood sugar. Thyroid hormone. You can have a virus that knocks out your thyroid, or thyroiditis, Hashimoto's thyroiditis, or Graves' disease. Then yes, you should replace that because you need that to live. But don't bother about the sex hormones. So what? You go through menopause. You know, what's the big deal? The symptoms will pass. The vasomotor symptoms should pass. Some women still have hot flashes and night sweats in their 70s. Some women, it goes away in 2-3 years. But it's what's going on metabolically by you not having those hormones. That's what I want to talk about. So they also say, traditional conventional wisdom says, if you're going to replace hormones, use the FDA-approved synthetic hormones, Premarin, which is horse or mare, pregnant horse estrogen. They get it from the urine. And it's called Premarin. It was the #1 seller. It made quadrillions of dollars for Wired Earth, which is a pharmaceutical company. And they also use progestin, which is not progesterone. Now, the reason why they do this, you got to understand, you cannot patent a natural substance. You can't just say, I'm going to patent estradiol, or I'm going to patent testosterone. It's a natural substance. You can't say this is mine. It's natural. So they have to do something different so they can get a 7-year patent or a 10-year patent. So then they can run all these tests, see that it's clear, it's not killing too many people, but you know, that's always one of the risk factors when you take any drug. And then they do all this research and development, get the drug launched, and then make a quadrillion of dollars on those drugs. That's how our healthcare system. In this country, pharmaceuticals, we spend too much money on drugs. Way too much money on drugs. So, and they have side effects. So this is a natural approach that I'm going to talk about. Some of the other hormones in your body, growth hormone. It's a hormone of youth. I just talked about it. Estrogen. There's 400 receptors in a woman's body for estrogen. We have 3 types. Progesterone, that's produced, it balances the estrogen. Testosterone is an anabolic hormone. It builds you up. That's the reason why you get muscle growth. That's the reason why your bone gets stronger. That's the reason why you burn fat. That's the reason why you become aggressive. It's an anabolic hormone that men need about 100-fold more than women. That's what separates a man from a woman, is their level of testosterone. When your level plummets, as a man, what do you think you become? You become more feminized. You do. And you could see men that are in their late 50s, 60s, 70s, or even earlier, when they have low T, they become very emotional. The estrogen level is higher because the body fat converts testosterone into estrogen. So yes, they become more feminine. They get gynecomastia, which is breast development, and so on. So it's a very important hormone for men, also important for women, but they don't need as much. Melatonin is a hormone of sleep. Aldosterone controls our sodium in our bodies and potassium. Thyroid controls our metabolic rate, and then insulin controls our blood sugar. These are the hormones you may have not known of, but we have quite a few hormones in the body, and it's all controlled by the brain. So calcitonin is what regulates our calcium. DHEA balances our stress hormone. It's a very important hormone because stress is a killer. Stress will cause you to eat too much or not eat enough. Stress will cause you to suppress your immune system and get infections. So you've got to make sure that you're managing your stress appropriately, and that's a part of having a healthy lifestyle. So all hormones are like playing music, symphony. You have your tuba, you have your horns, you have your sax, you have your drums. If one of those instruments, or if one of those hormones is too high or too low or playing its own tune, that whole symphony sounds horrible. And that's what happens to your body. So restoring them to that metabolic balance, that appropriate balance, is crucial to overall health and longevity. Okay? All right. So as a woman is younger, she has different worries because of different hormonal imbalances. In her 20s, she has acne, weight gain. In her 30s, most likely she can get pregnant, or in their 20s. They can have irregular menses, may have some libido issues. In the 40s, then you have sleeping problems. They start increasing their body fat, which is called sarcopenia. 50s, then the wrinkles come, the hot flashes, and more body fat. 60s, their genitalia becomes dry and starts atrophying. So you see, as you get older, you see, look at what you got to look forward to. So who wants to get old? Right? I mean, it's not a good. Yeah, you can age gracefully, though. I'm not going to spend any time on that. So the cycle, most women, you got to understand that a woman is a different person every day. You know that. Because their hormones are different every day. All right? So the typical cycle, the first 14 days, it's a 28-day cycle. The first 14 days, a woman has an increase in levels of estrogen. Pretty much no progesterone. On that 15th day, when the egg ovulates, then progesterone comes out to balance that estrogen. And it stays high till about day 25. If there's no pregnancy, the progesterone drops down, and then bam, you start to cycle, a woman starts to menstruate. Menstruation normally takes about between 3 and 7 days, depending on if they're lucky or not. But so this is the cycle. I'm not going to get into too much more detail than that, but that's what happens. Right around 35, 38, a woman starts to experience perimenopause. Perimenopause. Not frank menopause, because frank menopause is when it's already happened. But the perimenopausal period can take as long as 10 years, 15 years, before cessation of menses. So, but the symptoms start because the imbalances start right around the late 30s, okay? So now, what's the most common thing that happens in perimenopause? A woman stops ovulating, or she doesn't ovulate every month. So she gets what they call an anovulatory period. So that's going to create problems with the balance of estrogen and progesterone. And then she can have a host of problems, from reduced libido, mood changes, irritability, starts having some hot flashes, yes, in their late 30s. I have women who have gone through full menopause by the age of 40. And it really depends on your mom, her mom, or, it's a family thing. So that's what happens. Then you have a syndrome where, because you don't have the ovulation, you develop progesterone deficiency. These are the common things that you'll see happen in women, and it's common over the age of 30. They start having problems sleeping, they get anxious and nervous, they get depressed, they can have irregular menses, and nowadays, because of the high sugar diet that many of us eat, we have a syndrome called polycystic ovarian syndrome, where women, they become obese, that the obesity produces a high insulin state. It's very chemical, but just try to follow me through. Hyperinsulinemia, or high insulin, causes a whole host of problems with your hormones. So the woman actually becomes a little bit more masculine, and they start growing hair, sideburns, little mustache, hair on the chest. It's like an epidemic, and it goes along with what we call the metabolic syndrome. Hormonal imbalance, anovulatory, they don't have periods every month, they may have 3 or 4 a year, or a couple per year. So if we hear that syndrome called PCOS, that's what's happening, and it's induced through our lifestyle. And it's an epidemic like metabolic syndrome is. I'll skip that. All right, so this is menopause. Menopause is when you now don't have enough estrogen, you don't have enough progesterone, and you don't have enough testosterone. It's a triad. It's not just estrogen, it's a triad. They all have to be balanced towards each other. So you can't have high estrogen, you can't have low progesterone or high testosterone. Everything has to be balanced. And no two people on earth is the same. That's why if anybody's putting you on hormones and not checking your levels, they're not practicing good medicine. We got to know where you are when you come in the door. So blood work needs to be done, and they have to do a full assessment. They have to check your liver, they have to check your kidneys, making sure you can eliminate the hormones properly. It's not just, okay, here, one size, let me write your prescription, which most prescription drugs that you get in the pharmacy are going to be like that. They have a few standard doses. With bioidentical hormone replacement, I can give you any dose that I choose based on your symptoms. So these are some of the symptoms that you get. Hot flashes I talked about. All of these we've actually reviewed, but fatigue and low libido and depression. So here's what happens in 2002, 2003 was when it shocked the OBGYN world, because this company was making billions of dollars on hormone replacement therapy. They were using horse estrogen, the equine, and they were using progestin. And here's what happened. So many of these women, they wanted to be on these drugs, so they did this massive trial. It was called the Women Health Initiative trial. And what they found is that they had to stop the study because there was an increased risk for all these bad things, breast cancer, uterine cancer, heart disease, and improved bone density when they were on these synthetic hormones. So I never used, what do you think the American College of OBGYN came out after this and said? They said, well, you shouldn't use it, but if a woman really wants to use it, that's between her and her doctor. So she should work with it and they've never really endorsed bioidentical hormones from a compounding pharmacy. Now, there's no patent on bioidentical hormones. The pharmacists, they use the same hormone, the testosterone, the estrogen, the estradiol. They use the same exact replica of what's in your body. So there's no side effect like these things. It's not stimulating some of these receptors and not the others. Let me just give you a quick example. If I give you a synthetic hormone and you have receptors in the brain and the heart and the scrotum, but you don't have it in the bones, that synthetic hormone is just going to hit those things, and it's not going to to be able to fit into those cell receptors. But when you're giving the original hormone, it's going to hit everything that it should hit. So you get that balance. That's what I want you guys to understand. It's all structural. These hormones, these chemicals have structural entity that has to fit in like a lock and key into these cells so that you can get the desired effect. Okay? All right. So here, I just talked about it. What's synthetic versus bioidentical? So you can't patent it. Provaria is not good. Don't use it. All of the side effects were related to unexpected side effects of progestin, which does not balance estrogen appropriately. And then the pregnant horse estrogen is converted to estrone, which is what we call the bad estrogen. And that's what stimulates breast and uterine cancer. So I think I'm getting, you guys are understanding. So now, let's talk about soy. Soy is a plant-based estrogen, and it has 3 proteins in it. Women of Asian descent, they eat a lot of soy. When they're going through menopause, they don't have the same level or intensity of symptoms as women in America because they have a lot more estrogen around and they eat a lot more estrogen. Their body fat is generally lower as well. And what I'm trying to tell you is that as you gain more body fat, you hold on to estrogen and it creates a problem in your body. So you really want to try to be lean as possible. There's black cohosh, which is another plant-based estrogen. Plant-based, it blocks progesterone, kind of elevates it, and it's available by prescription, but we can get this stuff over the counter. We have a concoction, an herbal concoction that we use. We call it female support or femme support, that we'd give to women while we get their lab work so they can help with their hot flashes and symptoms. But it's not something that I would recommend just to be on, because I do recommend restoring your hormones to those proper levels. Okay. These are other plants that are natural. Licorice has some properties, Donquai, Vitex. I'm sure you guys have seen these in the health food stores. So bioidentical hormones are available at compounding pharmacies. You're not going to get that anywhere else. So we use Atlantic City, and you met Dr. T. Fan, who's the chief pharmacist and owner. And they use pills exclusively, creams and pills, some troches and stuff like that, things that are done sublingually. Wyatt, when bioidentical hormones came out, Wyatt lost about 60, probably like 70% of their market share selling these synthetic hormones because people didn't want to take them anymore, right? So the best route is to apply it either topically with a cream or a gel, or I'm going to talk a little bit also about pellet therapy towards the end of the presentation. So we have a bias preparation, which gives you the 2 good estrogens, the estradiol and the estriol. You can do your progesterone. It's better to do progesterone in a capsule because it helps with sleep, and many women suffer from sleep issues when they go through the menopause. Testosterone, it can be given in a cream as well as pellets. Pregnenolone is a hormone of memory. Many women, as they go through menopause, their memory gets shot. So you restore this, you give it to them at night. DHEA helps with fat burning and energy, and also balances cortisol. I talked a little bit about stress. These are my slides on stress. Stress, when you have chronic stress, it is bad. It suppresses your sex hormones. It suppresses your thyroid hormone. So cortisol has a direct effect on the thyroid. It makes you more fatigued. It has a direct effect on your sex hormones. So it gives hormone irregularities. So you're not going to get the benefit of hormone replacement if you're stressed out. So you have to change that. So if you have to get a new job, move, find a new spouse, you want to live long, you have to do something or deal with it better, right? So we always recommend massage therapy. We recommend exercise at least minimal 3 times a week, but ideally 5 times a week. We recommend meditation. Yoga is an excellent form of stress release as well. So I try to do all of that, mix it up so it doesn't get too monotonous or boring. So this is what happens when you're stressed out. It's just a bad thing. So we do have supplements that we use to treat adrenal fatigue from chronic stress, and these are all stuff that we have available here. I won't spend time with that. So, but nutrition is the key. Nutrition and exercise is the key. You want to cut back on your processed carbohydrates, white flour products particularly, and sugar. Increase your protein and fiber. Whole grains are okay, but not too much of that as well, because it can be inflammatory. Fruits and vegetables are always good. And then when you exercise, don't just say, oh, I'm going for a walk. I mean, you know, if you're 80 years old, yes, you can go for a walk. But if you're 50, 60, 70, you should still be exercising, and weight training is important because weight training builds muscle and it strengthens your bones, right? And so when you do weight training, while you're not exercising, because you build muscle, your metabolic rate is higher. So you can actually eat more when you do weight training, right? So you have to get both, not just aerobic. So in summary, finishing up on the women, all hormones in the body are designed to work together. As you get older, the glands will produce less hormones. You can do herbal nutrition with plants that have estrogen and progesterone, like I just mentioned, the licorice and the black cohosh. But the bioidentical compounded, customized hormone replacement is the only safe way to achieve this balance. So one size does not fit all. You need to get your hormone levels checked with an expert who could give you what you need and play with the different dosages. And you know, that's how you're going to reach what you need and live longer and more enjoyable life. Okay? All right, so I'm going to take a 5-minute break. I want whoever who just came in the back, they can get some refreshments, then I'm going to talk about the men. We have 1, 2, 3, 4, 5, 6 men. You guys make sure that you understand. It's going to be another 20 minutes on the men. It's a little shorter. Okay? So get some refreshments, stretch, do some woosah, whatever you got to do just to relax a little bit. I'm going to give everyone 5 minutes. Okay, so for the men's group, for the men in here, there's 10 questions, and each of those questions, if you have a yes in 1 or number 7, chances are you have a low testosterone. If you have any more than 3 of the others, chances are you have low testosterone, if you have not been checked. It's a simple blood test. And I'm sure once you start replacing it, a lot of those symptoms will be reversed. For the women, a lot more complicated. I know there's a whole lot more questions because women are definitely more complicated. They have more hormones that they're dealing with that has to be adjusted. So if you complete the forms correctly, each of those sections under estrogen, progesterone, testosterone, and cortisol, if you add those numbers up, and if any of those sections are over 5, then you have an hormonal imbalance. Okay? So you don't have to share it with me or share it with your friend, but this is just a screening test that we do for everyone. And we actually monitor them every 3 months by having them complete those forms to see where they are. Okay? So it really is a pretty exact science. Okay? All right. Are we ready? Yeah, okay. Well, I'm just going to go ahead and start. I don't want to keep people too long. All right, so now for the women that are here who have a significant other, this is good information to take back to them because I think you're going to find that as a man gets older, these symptoms are very, very common. And I can tell you, most men that I see, my typical patient in the Regen Center is a guy in his 50s to 80. Sometimes I get some of the younger guys, and sometimes in the 30s. They have symptoms. I don't know what's going on with the environment, but I can tell you that men as young as 30 are now coming to see me because they have low testosterone. I don't know what's going on. Is it the food? Is it the radiation from cell phones, cell towers? Is it the fact that they carry their cell phone in their back pocket and it's causing damage to their testicles? I don't know, but there's a variety of things going on. But low T, low testosterone, or andropause, is affecting younger and younger people. I'm going to talk about what male andropause is. I'm going to talk about how a drop in testosterone affects your aging. And I'm going to talk about the many effects of testosterone and the forms of how you can replace testosterone. So here's it. When you're young, in puberty, right around the age of about 11 or so, the brain says, and I have 12 to 17, the brain starts putting out LH and FSH, which are the stimulating hormone, to tell the testicle, hey, it's time to mature this young man, and his voice is going to get a little deeper. He's going to start thinking, he's going to have body odor, and he's going to start growing hair at different places. So it triggers, right around that time, the brain says it's time for that development, and then his testosterone just starts to go up. And the other androgens, which are DHEA and androstenedione, those also go up. And that's what makes a young man turn into a man. His size of his genitalia also increases. So everything is happening over this period of time. He's getting taller, he's getting his growth spurts. So testosterone is the principal androgen, and it's what makes men different than women. So now, they've enjoyed the high testosterone till about close in the mid-30s, 40s, then the hormone starts to decline. And then what they notice is now they can't perform as well sexually. They realize now that they are not as sharp cognitively. Their memory may be a little less or slowed. They may have to think longer to remember things. They start getting the abdominal truncal obesity. You know, they used to eat this way when they were in the 20s and 30s, and they never gained weight, but now the tire starts coming. Their muscle mass, because now they don't even have the energy, they don't exercise as much. Even though, you know, there's a shift. It's through lots of educated people. They're making sure that they're fighting the aging process by making sure they're exercising and eating better. So it's all about being an educated consumer, because you're going to produce better health than the uneducated ones. You won't eat McDonald's every day. You won't drink soda pops. You won't drink juices like it's going out of style. And you won't eat cake. Cake is my biggest thing. People love cake and ice cream, but those things make you fat. So anything that's a sugar is going to turn on your insulin, and you're going to start storing fat. Understand that. So now you have testosterone in your brain, in your heart, in your bone, and your muscle. You have it more places, but I'm just emphasizing those. You have testosterone receptors. So the testicles produce testosterone. It only has two functions. The male testicle has two functions. What are they? Come on, somebody knows what this is. Produce sperm. Exactly. And the next thing, what I'm talking about, testosterone. That's it. It does nothing else. That's right. And the reason why it's outside the body is because sperm needs to be cool. So that's why it's an extension of the body. It's outside of the body, the testicles are. So as these hormones decline, you can see the aging process takes place. So why would you just let it keep going down, 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 and you're becoming this way, when you can maintain your vigor well into your 80s by replacing it, right? Okay. So here's male menopause. It's not as sudden as female menopause, where they wake up with hot flashes and they're very dramatic. It's a subtle thing. So you'll never hear a guy say, hey, I think I'm going through male menopause. They won't do that. It's more or less, they just kind of start losing their zeal a little bit, that zeal for life. They get a little bit more sad, and that's the thing, sadness, Men, they'll be like, you wonder why they're just not as up and going, peppy anymore. That's one of the first things I notice, just kind of going through the motions. But it's just as severe in long-term problems. When you have low T, your heart ages. In China, they use testosterone. Remember, the heart is a muscle, and testosterone builds muscle. In China, when someone has heart failure, they actually use intravenous testosterone to help with the contractility of the heart. And in this country, we have hypertension that causes congestive heart failure. So the testosterone actually increases the force of the heart and prevents people from going into congestive heart failure. So think of that. That's one of the reasons. If your heart's aging and it's losing its function and it's working like this, you won't be able to run a 5K. You won't be able to do, have sexual intercourse with vigor, right? I mean, you'll be kind of slow. I'm just teasing. So when it's low, your drive, you don't have the drive, you don't have the competitive edge. You can get more sore in your muscle stiffness, and I talked about the truncal obesity, which is the most visible aspect to low T. And you get visceral fat, which is fat around the organs, the liver, the kidneys. And that fat, that's the fat that's mobile, that goes into the bloodstream and causes problems. So andropause is a deficiency, and it's lethal. In 1990, they confirmed that 1/2 of healthy men between the age of 50 and 70 have a testosterone level below the lowest level in men's 20 to 40. So there's a big drop off once you hit 50. So which one comes first? Is it that your testosterone drops and then you get old? Or you get old and then your testosterone drops? Either way, it's replaceable. It's a very important point in anti-aging. This is one of the strategies that we use to maintain people's vigor. You get diabetes when you get obese, brain dysfunction, heart disease, you become more frail, and you get fractures. And obviously you get a risk for cancer as well. Bone fractures when you have low T. Risk of cancer goes up, not down. What causes prostate cancer? This is a big point. High estrogen in men stimulates those prostate cells, not testosterone. Testosterone is a growth hormone, but it's not what causes the prostate cancer. It's the estrogen that causes it. It stimulates the prostate cells, and it causes those cells to divide. So you want to keep your estrogen down and keep your testosterone up. So middle-aged men will experience depression, fatigue, abdominal weight gain, alteration in their mood and cognition, a drop in libido, erectile dysfunction, enlarged prostate from the fact that the estrogen is stimulating the prostate, making it larger, and heart disease. And it can happen as early as 50, but it can happen earlier in men who smoke, who have unhealthy lifestyle. So you go to a doctor and you say, "Doctor, I just don't feel that good." He says, "Okay, I think you're just depressed. So let me give you some antidepressant. I'm anxious, so let me give you some Xanax." And here we are, we go down this path where we're treating these symptoms of a very common condition. We're giving people drugs for this stuff. I talked a little about the estrogen. This is the slide that tells you. Estrogen goes up in men as they get older because the body fat converts it. It's an enzyme called aromatase that converts testosterone to estrogen, drops your libido, increases your risk of heart attacks and strokes, and causes the prostate to get bigger. Testosterone stimulates the libido. It helps your libido. It helps you to think about it. Now, I want you guys to understand that when you have a libido, it means that you have a desire for sex. It doesn't mean that because you have a desire that you can actually perform. Performance is based on your ability to have an erection. So you can have a normal libido, but you have erectile dysfunction, so you cannot have sexual intercourse. So that's a vascular problem most of the time, where the blood flow is just not getting there. That's why what drugs now are on the market that increases the blood flow to the penis? Which one? Viagra. What else? Cialis and Levitra, right? They have actually injections of alprostadil, which causes the penis, the blood vessels in the penis to expand, and many people are on that as well because the Viagra and those drugs don't work. But arginine and nitric oxide, those are the things that increases to improve blood flow to the penis. And unlike women, a man really can't have intercourse unless he has an erection. A woman can still have intercourse, right? You can fake it, but a man has to be able to get that good circulation. So part of it is not only having the desire, because having the desire will stimulate the blood, but it doesn't work when you have vascular disease as you age. So you have to take something for that as well, okay? So some people say, well, Doc, I feel better, I have more energy, but I still have ED, and so we have to treat the ED too. It's separate, right? The testosterone is going to make you all of a sudden have rock hard erections, and we're all adults here. This is what we have to talk about, and I talk very candidly with my patients about this type of issue, and it's a major part of feeling alive and feeling well, is to be able to perform. All right? So, finishing up on men, it's very important for libido. Testosterone does not cause prostate cancer. Estrogen does. I went through that. PSA is no longer recommended when a man comes in. The digital rectal exam is still done to check for lumps and bumps in the prostate, but they don't recommend, the U.S. Preventive Task Force do not recommend doing PSAs, because the most common reason why a PSA is elevated is benign hypertrophy or prostatitis, an inflammation of the prostate. It's not prostate cancer. And what they found is that because these PSA were elevated, they were bringing in men to get prostate biopsies and ultrasounds and doing all these tests, and it wasn't cost effective for them to pick up one cancer when they've had done all these tests. Okay, so they don't recommend it. I still do it, but the digital rectal exam is a very important part of it. Okay, and obviously family history, because African American men tend to have a much higher incidence of prostate cancer as well. So when you lose testosterone, mental decline, low levels cause the loss of ability to concentrate. You become moody and emotional. And you saw at weddings, you'll see a man crying at wedding. Maybe his daughter, I understand. You're very emotional about it. But still, it's, when you start bawling, it really is because your hormones are not balanced, and you probably have more of a higher level of estrogen. You become more timid, you resist any type of confrontation, you feel more weak, your memory. Okay, you want to share that? No? No. You want to share it? Oh, okay. All right, no? All right, so it's private conversation, I guess. I'm not supposed to hear that. But feeling weak, unrest, and so on. Testosterone in the heart, I mentioned before, it's very important for the heart function. And it causes vasodilatation. It opens up the blood vessel so you can actually have better blood flow to the heart muscle. So here's the conventional wisdom. We talked about conventional wisdom for women. This is for men. Drugs are the conventional wisdom. So when a guy has high lipids, they give him lipid-lowering drugs, such as statins. They put him on hypertensives. They use hypoglycemic agents when they have blood sugar issues. They'll use anti-obesity drugs like fen-phen and phentermine. They use blood thinners and anti-inflammatories. Or if those don't work, then they do the Roto-Rooter. They go in, they do a cabbage, or they put stents in to clean it out. And it's all vascular disease. You know, if you have blockages in your leg, they do what they call a fem-pop. If it's in the carotid, they call it a carotid endarterectomy. They do cardiac catheterizations, angiogram, balloon dilatation. Now, when people have blockages in the brain, they can actually go in there and put stents in the brain as well. So this is all vascular, but this is a lifestyle disease. You don't have to get hardening of the arteries so bad that you get a stroke or a heart attack, or you knock out your kidneys. You eat right, you exercise, you do the right supplementation, the right balance your hormones. You don't have to die of the nation's #1 killer, which is heart disease. The integrative approach, once again, stress reduction. You're going to see that when you come, if you come here, you'll realize we focus a lot on reducing stress, because that is what's causing a lot of the metabolic derangements that you see in your body. Nutritional supplementation and exercise. Relaxation techniques, massage, I talked about some of those. And then your diet. You need omega-3s, it's very important. Lean protein. The animal fat is never good, so always, I don't have any problem eating steaks, but you want to do a lean, you want to trim the fat. Don't eat the animal fat. People say, oh, that's the best part. Eating fat is not healthy. That's where all the hormones are stored. That's where all the heavy metals are stored. So you don't want to eat fat. Even skin is not that good. And then you need a good wellness exercise program. We have our program here that we can show you how to live and how to prevent disease through our 8 weeks to wellness program. 8 weeks. You get massage therapy, exercise, you get some meal replacement, you get your fish oil, chiropractic, which is all important. It's a big program. I'll give you a brochure on that if you're interested. So here, these are the prescriptions for andropause. They use the patch. It only has a couple of dosages, and they have to, what they're patent here is not testosterone, they're patenting the delivery system. That's what they do. And then they add a little molecule to it, which makes it different from testosterone. They always have to do that to patent stuff, okay? So I don't normally recommend that, but if somebody doesn't have any money and their insurance is going to pay for it, the testosterone patch costs about $300 per month. If you have insurance, your insurance will probably pay most of it, and you'll have your highest copay, which will probably be around $60 to $80. If you do bioidenticals, it's much less than that. It's not $300 for a 1 month supply is about $50, and then you're getting the real thing. Yeah, so the pharmaceuticals basically are focused on one size fit all. They just have a couple of dosages that you can order and prescribe. You cannot taper it the way you can with bioidenticals, and they're pretty expensive. Now, synthetic testosterone, such as danazol, these are what the bodybuilders shoot themselves up with. They can get liver cancer from it. Should not be used, and it's in red. It causes cancer. So I don't do any of that. Natural bioidentical testosterone is identical to the testosterone made by your testicles. There's no difference, and it's compounded, and you can do it by injections, you can do it by pellets, or you can do it by creams and gels, and that's the normal dose. Pellets are done twice a year. The creams are put on every day. So here's what you can expect. You can expect your erectile dysfunction to improve. It probably won't get completely better if you have vascular disease, but it will definitely improve. Cognitive function will improve. Your mood will improve. Blood flow to the brain, reduce dementia, Alzheimer's, reduce heart disease, reduce inflammation, reduce prostate cancer, because they go back and when they check people who develop prostate cancer, they all have low testosterone and high estrogen. So testosterone is actually preventive for prostate cancer. As in the women, we have supplements, natural stuff God put on earth to help with testosterone. You guys may have heard of chrysin or muropalma. Those are all good things. Nettle root is good, but they're not as good as the real thing. But I always mention those. All right? So what I'm going to spend the next 5 minutes on are pellets. I want to talk about pellets. I have a lot of women and men who are on pellets. Then a lot of them start with the creams and then they choose to go to pellets. Now the pellets work because once you put it in underneath the skin, if you're going to exercise and your heart rate's going to go up, the blood flow to your skin increases. So it's more on demand. You can get it. When you put the cream on, you put it on in the morning and it's good, but then it fades. So the next day you got to put it back on. The injections, when you do the injections, you have to do at least twice a week to get a somewhat physiologic. But when you give it, it goes up initially, 1-2 days, and it drops. 3 days, goes up again, you have to give another shot. So you get more of a bell shape. When you get the pellets, it goes in, it stays there, and it stays for about 5-6 months. For women, about 3 or 4 months. So that's what I like about the pellets because of that. It's somewhat more effective, it lasts longer, it increases the bone density quicker, and it's painless. Once you get the anesthesia in, it's painless. One injection gets it in. And it's delivered 24/7. Symptom relief versus physiological change. With other delivery method, they control the body and create symptom relief. With pellets, the body is better able to regulate the release of hormones over time. So here's a good example of what I'm saying. These are with the implants. This is where the level stays. This is with the patch or the cream, up and down. And these are when you take it orally, which I never recommend taking estrogen orally or testosterone because it has to go through the liver. So I don't do that. We don't do that. It's not safe.
For it, like daily pills.
Exactly. Yeah. Stimulates the liver. So for women, 3 to 4 months, they'll get pellets, and for men, every 5 or 6 months. Here's a slide that really shows you the effect of pellets on bone density. You see, patches and creams about 5% increase per year, but with pellets, about 8%. And here again, it shows the bone density increases. You can see with the patch it's about this, with implants it's that, vertebral and femoral. So in conclusion, wrapping up, andropause is the reduced production of testosterone caused by aging. And andropause can be effectively treated to slow the aging process by improving your mood, your body composition, reducing heart disease, and improving sexual function. Bioidentical hormones is safe and effective alternatives given to the right person. Obviously for women, we do mammograms and pap smears, make sure nothing is brewing before you get pellets. With men, we will check your PSA and do a digital rectal exam to check your prostate. So you have to, and then we do your lab work, a full component to check your liver, kidney, make sure everything is working properly, and then you can get started. Compounded pharmacy should be viewed as a low-cost option to the FDA-approved synthetic drugs. Very, very important. This is where we're located. You know, we worked, it's actually strictly, we don't work with any other compounder for our bioidentical creams and pills than Atlantic City Pharmacy. So that is where we go. That's where you would get your medication mailed to you, or you can pick it up. This is where we're located. This is our website, anwanregencenter.com, and we pretty much do everything. All right, so I'm going to open it up for questions, and then I'll close.
Is it FDA approved also yet?
Well, you know, FDA approval is a very tenuous thing.
Right.
Stem cells are not FDA approved, yet still we do it. It's not considered FDA approved that way, because to get something FDA approved, you have to go through all these trials and a lot of money. And that is why pharmaceuticals are so expensive, because they have the money to go through phase 1 trial, phase 2 trial. Anything natural, they just don't have the money for it. But they don't bother you because it doesn't have any problems. That's the same thing with stem cell and PRP. They don't bother you. And you can use things off-labeled anytime. It's not an issue. You'll never be sued for using it.
So it's not regulated and they don't...
No, they do regulate the lab. Why don't you speak on what they do with the lab?
Yes, absolutely. So the pharmacy is strongly regulated by the Board of Pharmacy, so it's regulated. All the ingredients that's in use have to be FDA approved.
Right. So you're not in there making all this other
and
stuff.
the regulation is very, very tight.
Yeah, right.
So it's not like you can just come and just make it.
Right.
Like there's rules, regulation that has to be met, and certain quality that must be met.
Okay.
Sir?
I understand that, and this may not be true, but that the testosterone supplementation in older men basically cause whatever testosterone production there is at that time, it basically causes it to shut down.
Absolutely. And in anybody. In anybody. Well, let me explain, because what happens is, remember I told you the brain is what's stimulating the testicles to make testosterone. So as you get older, your level, the brain hormone is stimulating a testicle that is now atrophied and have more fat in it, more scar tissue, so it's not putting it out, right? So you have this stimulus from the brain. What happens is when you give your body testosterone, the body senses, oh, there's testosterone. So the stimulus that was doing that goes away. So what we do with men who we have on testosterone, we give them something to stimulate their testicles, because testicular shrinkage or small reduction in size will occur with testosterone replacement. So that's why we give you something to take.
But what would stimulate it?
You have HCG or clomiphene. Those things can stimulate it.
Is that a process reversible for somebody with
Absolutely, it's reversible.
Okay, once you go off.
Once you go off of it. Exactly, yeah. Very good question. Yep.
Is the same true for women?
No. No, that doesn't happen with women, because, you know, the normal process is that you would go through menopause and then your estrogen and progesterone would just shut down anyway. So when you get on it, you're just basically replacing it. Yeah.
You mentioned that men is twice per year for the pellets, and
Yeah.
women is 3 to 4 times?
3 to 4 times.
Is that based
Why?
on weight or what?
Well, you know what happens is that we give the men 1,600 milligrams to 2,400 milligrams, so it lasts longer. We can't give women more than 100 milligrams of testosterone. You don't want a woman to become masculinized. Yeah, so it only lasts about 3 to 4 months. And the estrogen too, that's what it is. You put it in, it lasts 3 to 4 months, and then it goes down. That's normal women. Then you have women who just consumes it regularly, just soaks it up, and then they're coming back within 6 weeks saying, oh, I think I need more. But, yeah, yeah, true, yes.
So how long does it take to, you go through all the blood work and everything, and then you, I guess, determine if you're a candidate, and then you get your first shot, or do you do a double dose first, or how does it?
No, well, you come in first for your consultation. We do your blood work. We checked everything. And we always tell people, make sure that they've had a mammogram within the last 3 years. Make sure they've had a PAP within the last, 2 years for mammograms, but for PAPs, 3 years. You need to have that. If you're over 65 or 70, that's when they don't recommend screening anymore. Like, okay, you can't get it anymore. Yeah, they should if it's ordered by the doc. But we get that information, and then the very next visit is when we would prescribe your therapy. And usually the first visit we just give you some supplements, and you'll start feeling better just with the supplements.
You send like the, I guess, blueprint of me to the labs, and then they create
the hormones. Well, no, we know based on your levels. If it's pellets, we'll put it into a computer, and we'll put your age, your weight, and all of that stuff in there, and it tells us what your dose should be.
Oh, okay.
Yeah, so it's calculated that way.
So it's not just geared exactly for you. You could have the same as somebody else's, or?
No, but you'd have to have the same weight.
Yeah.
You'd have to have the same. So everyone is different, right? So it's done that way. And then, as the expert, I get to adjust that. If it comes back, I'm saying, no, that's too much.
Wow.
I'll adjust it. And that's why it's called practice in medicine.
And how would you know if it's too much? What would the symptoms be? Or
Of what? Too much testosterone?
well, too much of anything that you put in the mixture. What are the signs going to be in the next month or two after you start taking them?
Actually, we don't. I mean, we have that questionnaire that you should have completed. It has estrogen deficiency, and it has excess. So all those, if it's excess, you'll have some of those symptoms on the excess. So every time you come in, we ask you to complete that. So we're monitoring that. And so if you're having too much of excess, like water retention, for instance, then we would back it down. That's how it works. Yes?
I've always been very alternative, and I have a counseling practice, so I've been telling all the women about this.
Correct.
However, I had a conversation with one of my friends who's also alternative, and she said there was a doctor, and I won't name his name, but he is an MD, and he is alternative, and he said he has had women who come in who are a mess, now I'm quoting my friend, who, because they were on the pellet, and you can't get it out, and they're for the moment at least, because they are on testosterone overload. Would you please comment on this?
Sure. Well, that's why you need to go to an expert. I'm not sure who they went to, but there's a lot of people who are not certified in it or have a fellowship. I had to go through a 3-year course to become certified. And then I went and got certified through Sotopelli and trained with the founder in his office. So it really depends. I mean, you're going to have across the board some people who really know what they're doing and some people who don't. But because they think it's going to increase their finances, they'll do that. But no, we're very ethical. And you can remove pellets. I have never had to remove a pellet, and I started pellet therapy back in 2008. I've never had to remove one.
But can this actually happen?
And if they put too much, let's say they give a woman 200 milligrams, that's way too much.
Right.
Then the woman may get a little aggressive and want to beat them up. Or beat up her husband, worse yet. Yeah.
I was going to comment on that. I think I had an experience with that where they were doing them every 3 to 4 months, and they were just consistently doing them every 3 to 4 months. So the testosterone level kept climbing.
Because they weren't monitoring.
Yeah, so they just
Yeah,
kept doing it.
you've got to monitor.
4 months. So they just kept doing it. Just,
Yeah.
okay, you start over, give you the same dose every 4 months. So the estrogen was okay, but the testosterone went up. So I got more crazy. I was like,
And that happened to you?
yeah.
Oh, gosh, okay.
So I think that's probably what it is. Just
Not with me.
No.
Just saying that. Not with. She just started with us about 3 months ago now. So
I can see how that happened.
I can attest to pellets. Dr. Christie, which is my brother-in-law, takes very good care of me.
and he's only 27. Look at him.
Something about pellets, everything is improved in a positive way. Everything. I mean, everything.
We're all adults here.
He's my hero.
Thanks, Jocelyn. You had a question.
No, you got it. She threw her question back.
Okay, yeah. So did you guys fill out the questionnaire? It's really important for you to look at it. That'll tell you if you think you need to be worked up. And if you do, we have people outside there that will help you to get on the schedule, and we can work you up. Okay. Laura is my office manager. There's my wife is right there. She's a nurse practitioner. She works up there as well. Dr. James Velos is my intern. Right behind you is Dr. Webby. He's my intern as well. So I have quite a good staff. Very, very, very capable. And very catering, let's put it that way. So we're here for you. Any other questions?
Can you speak to about like coverage and insurance coverage? And
That would be Laura or Hope. Where is Hope, by the way? Oh yeah, and Hope, she's our front office person. Yeah, they'll help you with that. So, Dr. T, come on up here.
where is this pharmacy located?
We're on Cheshire Bridge Road in Atlanta.
Okay.
Yeah. So if you don't know what Cheshire Bridge Road is in Atlanta,
It's in Buckhead. It's in Buckhead. So they can ship it to you. They get it usually in 2 days, or go there. You obviously you can pick it up on same day, right?
they can, yeah. If we get there early, yeah.
All right, so we have some turkey wraps back there. I noticed nobody touched them. Please take one. We don't want to keep them all here, and then that means somebody else has to eat them. Any other questions for the pharmacist or for me?
I'm just looking at his biceps and I want to know what you take for that.
For his biceps? He works out. He works out 5 days a week as well. You got to look the part. You got to look the part.
Well, thank you everybody for coming, and it's been a pleasure having you here. I'll be around here. Dr. Christie is going to be around for a little while, so you guys have any questions, feel free to ask. All right. Anything else you want to add?
No, I'm good. So thank you so much for coming. I hope you learned something.